Good afternoon. I'm Dr. Lisa, the President and CEO of Parents Anonymous Inc., one of the oldest family strengthening organizations in America. We envision a just society where every parent, child, and youth thrives in resilient families and communities, and we do that through our evidence-based programs. We're here today doing our podcast on breaking the stigma because it's Mental Health Acceptance Month, not Awareness Month, but Acceptance Month, so that people can take the idea of mental health out of the closet, unpackage it, and get the help they need. We offer in California the Parent and Youth Helpline, 12 hours a day, 7 days a week from 8 to 8, that if you're having any concerns and you're a parent, youth, or child, you can call it, you can text it, 855-427-2736, or go to the website for resources or to live chat us at caparentyouthhelpline.org. On top of that, we have a free weekly support group for parents and a separate program for children and youth for them to deal with their underlying emotional issues, develop new strategies, and become the parents they want to be, and get that support for whatever they're struggling with or their children are struggling with. There's no issue that we can't address at Parents Anonymous. And I have here today Antonia Rios, a Parents Anonymous parent who came to Parents Anonymous 15 years ago and is the outreach and parent partner manager at Parents Anonymous Inc. And I wanted you to join us today to talk to our audience about what does breaking the stigma mean for you?
Well, it means making change within our family, not repeating the same cycle of trauma. Teaching our children that asking for help is a sign of strength, and knowing that when they do reach out, that they shouldn't feel or they shouldn't be ashamed that they're reaching out for some support. They should be proud of themselves for taking that step, opening up and letting somebody know that they're struggling.
So how does it relate to your journey in mental health and wellness and strength?
In mental health, wellness, and strength. Well, growing up, we were taught silence was the key. What happens in the family stays in the family. And so we endured so much trauma growing up. And so today, it means for me to know that I can tell my kids, no matter who it is, including myself, you have the right to speak up. You have the right to go get help, to tell somebody something's going on. When it comes to our mental health, that is something that we live with on a daily basis, and we're always ashamed and embarrassed to let somebody know that we're struggling. I fear sometimes that we don't give our children or our family members the space to accept that it's okay, knowing that sometimes we can't change things, but we can at least be there to get the support that we need. Speak up and get that help. Or if you see somebody and you feel that they're struggling, take that time to step aside with them and let them know, I'm here for you. Whatever it is, I'm here to support you. And then we can work through it together.
But that's been a journey for you as a process.
Yes.
Because a lot of people are afraid when somebody says to them, I'm feeling really sad, and you can get happy, or they want to give an excuse, or maybe they can't open up. It could be values in their family, the way people acted. But for you, what changed for you so you were able to ask for that help and receive the help? Because there were times that we don't want to deal with it, right? It's like, we got a problem, but let's put it under the rug.
Well, I did a lot of programs, a lot of groups, a lot of classes, and some treatments, and nothing worked. It wasn't until I came to the Parents Anonymous groups that I started to hear that it was okay to speak up. I started to hear that asking for help was a sign of strength. And while I was attending the groups, I started to feel that I was in a safe environment and that I would be able to address these traumas, the fears that came along with my own mental health. And when I started to do that, open up and get the support that I needed, it became that much more, what's the word I'm looking for? I became more aware of when these things were occurring, when I was falling into depression or when I was having anxiety or stress, and how I could reach out to get the support so I can manage it. Sometimes it was easy and sometimes it was not easy.
And how has the helpline, as an added feature to going to group, helped you in addressing
The
COVID
helpline.
or any time in the last 3
The
years?
helpline has been, group, you go to group, you're there for 2 hours. After group, you're left with all these feelings sometimes. And then in between groups, you go through emotions. Having the helpline was a lifesaver. Having the helpline was like always knowing that my foundation would be solid no matter where I was, because I could utilize the call, the text, and the live chat feature at any time. So being able to do that and reach out and say, I'm struggling with this, or, this happened in the home and now what do I do? Or I'm feeling like this, but I don't know how to approach them about it. Being able to make that call to text, being in a surrounding where there could be a bunch of people, and it may be my kids that I'm like overwhelmed and stressed out about. They don't have to know that they're stressing me out. I can go on that live chat and that text and communicate what I'm feeling in that moment, and then be able to address it with my kids.
And I'm sure it's been very important with your son Ricky when
Yes.
when he was feeling suicidal, how the groups and the helpline helped you and him. Do you want to share?
It helped more than just him and myself.
The whole family.
Really helped the whole family and our friends and those that were close to our family. Be able to call the helpline. My son was having suicidal ideation and he didn't get the support that he needed. And we won't say from what locations, but he did not get those supports in any of those areas other than the group and the helpline. He made it very clear, I'm not going anywhere until I go to group and talk to my peers. Now, to hear an 11-year-old say that, it's really amazing at the strength and courage that he had, and knowing that he had a safe place to speak about this, and then use the helpline, and then get him to the hospital. And then I learned how to advocate because of the groups that I went to, because the support that I got, that I was able to say, you're not doing your job, so I'm gonna do the job that needs to be done to save my son's life.
And parent leadership and youth leadership is so developed.
Oh, yeah.
Not just you as a shining example in your last 16-year journey, that in Parents Anonymous in the group, the parent group leader, that we're always telling parents that identify what's needed, be the leader in your life, look at solutions as you're navigating things in your life. And then we provide these outside opportunities to speak, to train, to sit on a committee. How has that changed you, all those leadership opportunities?
It has changed me in a positive way. I've always been the kind of person to voice things out in a negative way, but being a part of Parents Anonymous and doing advocacy and outreach, I learned that I can use that same energy, but in a positive way. And so,
That's great. And you've done it in a really brave way. You are the reason that the governor of California decided to take the idea of the helpline and go for it. You were brave enough to share your story at the governor's office and to also share it with the California Department of Social Services. When we went into lockdown and I called them to pitch, they remembered your story and how important it is for parents to share their journey, because that is inspirational to other parents, number one, but it also shows the policymakers, well, this really works. And that human story is really important. We've been able with the helpline statewide to touch at least one parent in every single county. We have children at a very young age texting us, calling us. We have people in a suicide ideation situation, such as your son, and we've had other situations. We know that every day we're saving lives and we're supporting the empowerment journey of parents, children, and youth.
Absolutely.
Can't say enough about that. So I'd like you to share more recently a youth leadership situation that your son did in the middle school related to advocating about the helpline.
Yeah, so my kids are always advocating and outreaching for Parents Anonymous because they know what it has to offer our children and our youth and our parents. And so they left some cards at their school, and it so
This
happened—
is a middle school.
Middle school.
Got it.
Yeah, and it so happened to be a 12-year-old who was planning on taking his life. And if it weren't for that card that he found, going into the stall, texting or live chatting, I can't remember what the mother had told me, he had planned. Nobody was going to be home that specific day of taking his life due to some bullying that was going on in the school. He found that to be an easier solution. And when he utilized that live chat or the text feature on the helpline card, he went to the office, let them know what was going on, called the parent, and he is here today because of that.
Another example, two parts of the helpline saving a young person's life, but to have the courage to ask for the help came from your son who went through the Parents Anonymous program.
Yeah.
So I always say Parents Anonymous is the gift that keeps on giving. The parents, children, and youth who experience evidence-based services become tremendous advocates in the community. And that reaching out from peer to peer, even though he wasn't handing the card at that moment, when you told your son, how did he feel?
He was really shocked. He thought, well, I'm leaving them around, they're just throwing them away. But to hear that actually somebody picked it up was really encouraging for him.
So what would be a last message you would like to leave with parents, kids, and youth when we think about mental health, well-being, and the struggles people have every day? What would be a closing pitch you want to do?
I would say use that helpline, whether it's call, text, or live chat. It doesn't matter where exactly you're calling from. If you're a parent, a caregiver, a brother, uncle, aunt, whoever you are providing support for a child or a teen or a youth, utilize that helpline and share it. I tell everybody I come in contact with is taking a picture of that card, sharing it throughout your contacts, putting it across all your social media, making it shareable, because you never know whose life you might save.
Thank you, Antonia. Namaste.
Absolutely.